Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. DrAndyRoark. Guys, I am here today with the one and only Dr. Sheila Robertson. She was on the faculty at the University of Florida when I was there. She is board certified in anesthesia and animal welfare in both the USA and in Europe. She is absolutely brilliant and amazing, and she has got some new research out. She is an author on the 2022 ISFM Consensus Guidelines on the Management of Acute Pain in Cats. And I wanted to talk to her about acute pain and pain management in cats. And man, we get into it. She's super excited about the Feline Grimace Scale and the Feline Grimace Scale app, which I was unaware of. And so, man, new tool in my toolbox. Guys, this is a great episode. We really get into it later on, talking about the back half of the podcast. We get a lot into action steps and what we can be doing in the practices. That makes me super happy. Anyway, all around great conversation. I hope you enjoy it. Let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. DrAndyRoark.
Welcome to the podcast, Dr. Sheila Robertson. Thanks for being here.
Well, thanks for inviting me. I listen in a lot. Never thought I'd be a guest.
Oh, you're right. I've known you for some time now. You were on the faculty at University of Florida when I was there. You were running my anesthesiology or anesthesia rotation when I went through, and that was the first time I got to spend time with you. I've seen you lecture dozens of times since then, all over the world. You are the senior medical director at Lap of Love Pet Hospice, which is a group that was founded by some of my classmates and dear friends, and they're a great group. And gosh, you're just everywhere. You work with the Global Pain Council for WSAVA, which is the World Small Animal Veterinary Association, and you publish all over the place. And that's honestly what I wanted to talk to you about today, is a study that you have put out with a group of collaborators. It's the 2022 ISFM Consensus Guidelines on the Management of Acute Pain in Cats. And so this just came out in January. I saw you were, I think you were doing some speaking about it at the VMX conference in Orlando. And I saw that I think you were on the agenda there talking about it. And I am a huge advocate for better care for cats. And I think pain management in cats is something that we have not traditionally done as well as we should as a profession. And so I look at this and I say, this is something that I would like to understand more. And I'm always checking myself and trying to make sure that I'm practicing good medicine, that I'm up to the current standards and things like that. So that is how I know you and kind of what I wanted to talk to you about today.
Yeah. So just so everybody knows what these are consensus guidelines. And
Okay.
ISFM stands for the International Society of Feline Medicine. So these are global. We wanted them to be able to be used around the world, where not, access to different drugs and different types of therapy can be very different. So we wanted to make them global. And the group that put them together is Paulo Stigall, originally from Brazil, now working in Hong Kong, myself, Brad Simon, who's at Texas A&M, and then we have Leon Warren from Australia was on them, and then Yale, Shiloh Benjamini. She is actually based in Israel, did her training here in the US, and then Sam Taylor, who is a specialist internal medicine and feline person in the UK. So we got that group together and decided that it was time to really focus on cats and give them an entire paper to themselves, not kind of tagged on to the back of a dog paper. So these are all completely feline only acute pain management guidelines.
So let's start at a high level. What are the objectives of the guidelines when you set out? So what were you trying to accomplish when you guys went to work on this?
Well, so it almost like, I can tell that you must have read them, because one of the opening statements says pain has traditionally been under-recognized in cats. And obviously, if you under-recognize it, that by default means it's under-treated, right?
Right.
So, and we also know that pain assessment tools aren't widely implemented. And so cats are very different from dogs. I mean, cats are, so good at hiding everything from people, and they're not as demonstrative when they're in trouble. And we know that from other diseases. And so we wanted to raise awareness of the fact that they, will be as painful as dogs after the same types of procedures or trauma. But there's lots of data to show that they're not treated as well. People are like, oh, I'm afraid to give a cat this because they have unique metabolism compared to dogs as well. So the objective was to really let people know that there are some very easy to use pain recognition tools out there that are now apps that you can put on a smartphone. And what does pain look like? And once you know what it looks like, you can actually score it. Because my philosophy is that we have an outcome measure for just about everything we do, right? Say a cat comes in with a fever, like a very high temperature. So you can't try and figure out what's causing it. You treat it, but your resolution is the temperature comes down, right? If they're diabetic, we follow their blood glucose. If they're, have renal disease, we follow their, blood work or SDMA. So what are people using as an outcome measure to say that they treated pain effectively? Other than I just think the cat looks better.
Right. Or the cat seems more fractious and anxious next time it comes in, and you think, oh, well, maybe we didn't do as good a job last time as we could have.
Yeah. And so, we spent quite a bit of time putting in really nice real life images that each of us, had of what feline pain looks like and how to, examine a cat and recognize pain. And we did quite a lot on talking about the feline grimace scale, which is which I like for a lot of quick assessments, because it's basically you look at the face and they're scored from 0 to 10. Now that is now an app that can be downloaded on a smartphone. And it's, is at the App Store, and everybody in the world has a smartphone. So you can download that app and use it cage side to start scoring, like you look at the pictures and you score their facial expression, and it can tell you. And then if you instigate treatment, if you chose the right drug and did the right thing and, things are better, the score goes down. Right.
Yeah. I'll put links to the app and also to the paper in the show notes so people can grab it. So how widespread do you think that monitoring of pain in feline patients is in vet practices? Do you see practices that are doing good monitoring sort of patient care? And we I think a lot of us do a good job of recording hydration status, recording temperatures, coming through and just check on general well-being. Do our patients have food? Do they have water? Things like that. Do you see a lot of practices that are doing an adequate, I'm just going to set the bar adequate. Do you see practices that are doing an adequate job of pain monitoring?
So I would say a lot of people are using good protocols, but they're not actually assessing how effective their protocols are. There was a paper just published very recently from, a large number of veterinarians, and it was based in Australia, and only 15% actually use a validated pain tool to assess pain in their patient population. So they're just doing it based on, well, I know if the cat is okay or not, right? It's almost like you look at the cat and you guess that its temperature is okay, but you don't actually take the temperature.
Right. No, that definitely makes sense. Do you see good systems that people put in place? When in your mind, when you see this, is this something that is hospital-wide? Is this support staff, technicians that are going by and sort of checking on this? Is it doctors? How sort of frequent in your mind does a monitoring system like this check in on the patient? Is this an hourly check post-surgery? Help me dig into the specifics a little bit. I guess what I'm trying to do is really imagine this in my practice and what it could look like.
So when I was working in referral practice, so university practices. So we were getting, pretty complex cases. And basically my wing men and women are the anesthesia technicians, right? And I think
Mhm.
that we need to empower technicians a lot more than we do, because if you think of yourself every day, Andy, you're probably in the surgery room, or your surgeons are in the surgery room doing surgery. Like the anesthesia techs, admit the cat, it has an exam by a doctor, and they often
Mhm.
examine it, you check it over, you decide on a protocol, they get it ready. So they've spent more time with the cat than you, so they know its personality, how it reacted to things, and then they take it to recovery, and they really are the advocate for that cat, because they know how it was behaving before, and obviously if it's now still nice and friendly and wants to play, everything went well. But if it's not, they could come to you and say, I don't think this cat is, doing very well. And you might say, well, that's your opinion. Let me look. And so
Mhm.
if you have a validated pain scoring tool, it's no longer someone's opinion, right? It's like, well, here's the temperature, and here's its blood glucose level. Here's its pain score. So it gives them, a lot more to advocate with, and for everyone to focus on trying to get that score down. And I think that's is important because it empowers them. And there is a lot, what I know, I have pictures that I sometimes show. Like when I go and
Mhm.
visit hospitals, I will see notices on the front of a cat's cage, and it says, will bite. And I'm like, why? Does it bite because it's painful? And if I ask, they go, no, it's just a evil cat. And I'm like, well, maybe it's very anxious, maybe it's very afraid, maybe it's very painful. So there is a lot of labeling and bias goes on, and then
Yeah.
people call it, like the diva cat, like it'll flinch if you just touch it. But to the cat, that pain is real, and it will escalate with each visit if we don't do the right things. And then we can talk later about the connection between fear and anxiety and pain, because that's more of a connection than we ever thought.
Yeah. So let's go ahead and start to unpack that a little bit, because I 100% resonate with what you're saying about, oh, will bite. It's a bad cat. She's evil. Diagnosis evil. Why do you think that we don't commonly make that distinction? Is it a lack of knowledge on our part? Is it a lack of understanding on anxiety, behavior, stress, things like that? Like, why don't we do a better job of understanding sort of why we get the reactions that we do from cats?
I think it is that we're moving in the right direction, and of course, there's been a huge initiative for feline-friendly, cat-friendly practices. Lots of people understand how difficult it is, to get a cat in a carrier and then drive it. A lot of them are motion sick, and people don't realize that, and yet there's drugs we could give them to make them feel better. They could be dispensed with antiemetics before their next visit. And then a lot of people are using gabapentin to make them, sedate them. But remember, that's an anti-anxiety drug as well. And I think, cats are, they don't like change. But the biggest thing is they get very, very stressed when they don't have control over their environment. And they don't get the same, I think, reassurance from having the owner there. Like a dog, is with its owner, and it obeys commands, and But I know we have bad, difficult dogs to deal with, but I think
Sure.
it's more common in the cat. But the cat really does not like a new environment, and that new environment is extremely threatening to them when they don't have control. And the control they have in most threatening environments is escape, right? And they don't have that at your clinic. And then if they don't live or haven't been exposed to dogs, and there's dogs barking and dog smell, that's very distressing to them. So certainly understanding what anxious, fearful cat looks like and what a painful cat looks like is important, but often they're both. They can be painful and anxious and fearful. And all of that's aversive and unpleasant. So we need to deal with all of it.
Yeah, so it sounds more like a holistic kind of generalized approach as far as low stress handling, how we're housing cats, things like that. All right, guys, I just want to jump in here with a couple quick updates. First of all, the Uncharted Veterinary Conference was last week in Greenville, South Carolina. It was amazing. We will have a virtual conference in the back half of this year. It'll be in October. It is our GSD for Get Stuff Done Shorthanded. That's right, Get Stuff Done Shorthanded is going to be a virtual conference, which means you can join it anywhere. It will be in October. More details coming soon. Registration is not yet open, but go ahead and get fired up. This is a great way to see what Uncharted is all about. See, is it really different from everything else like people say it is? Yeah, you can come and see just how that works online. And then, if you love it, we'll see you in person April next year in Greenville, South Carolina. Or if you're a practice owner, we'll see you in person in December for our Practice Owner Summit. Gang, if you can't wait that long, and you know you can't wait that long, we have a couple of workshops coming up. We have Retain Your Team. Speak the languages of appreciation in your workplace. That is with Dr. Tracy Sands. It is on May 21st. It is all about showing your team appreciation. You know they're tired. You know they're overwhelmed. You know that they want to feel appreciated for their work. Are you doing it right? Are you showing them appreciation? There are simple things that you can do that really make a difference. Guys, this is, as I said, May 21st, 2 p.m. Eastern, 11 a.m. Pacific time. It is $99 to the public. It is free for Uncharted members. Jump on, get registered, come and be there. This one is actually already filling up. It's a month away, and there's the spots are largely taken. So jump in there and grab a spot while you can. On June the 8th, my friend Bill Schroeder, founder and CEO of In Touch Veterinary Communications, is doing his workshop, Creating Content That Clients Crave. This is all about making information in a way that clients will want to consume it. If you're tired of trying to educate in the exam room, if you want some backup, if you want some help, if you're like, I don't have enough time to communicate everything I need to communicate, jump in on this webinar, it's a workshop. You're actually going to work on the thing. That's the difference. In a workshop and a webinar, we do the thing in Uncharted. June the 8th, 7 p.m. Eastern, 4 p.m. Pacific time. This is $99 to the public, free for Uncharted members. You can hit the link in the show notes and get registered for that as well. Guys, that's enough from me. Let's get back into this episode. What do you think are the keys for sort of implementing this in practices? Like, what are the from the things that you see? What are the most important changes to sort of make to try to get practices sort of up to speed? Are there approaches that seem to be particularly successful in getting the team on board and actually making changes?
Well, I think the AAFP has some very, very good courses that anyone can take. I mean, from veterinarians, technicians and nurses, all the way down to anybody that even works in your clinic and at very reasonable cost can be, get certified or take a training course in cat, how to handle cats and recognize, what they're likely to do. So I think the Feline Friendly Practice Program is phenomenal, and it's coming up on its 10-year anniversary this year. And I think that's made a huge difference to how we understand cats and allows people to work through learning about those things. I think we all understand like the exam room should be a little bit different, using pheromones to calm animals or cats down. Owners can have a Feliway wipe to, in the carrier before they even come. And again, doing a cat exam, it's just like, you can do a little bit, then you just give them, you can't force it, right? You just got to take your time. And I think the pre-visit gabapentin, which is what most people use, some use trazodone, but I think the pre-visit gabapentin has been very, very successful for a lot of people. Yeah.
Yeah. That's a trend I definitely would like to see continue to spread.
Yep.
I'm amazed at how many practices do not have pre-visit, gabapentin or other sedative anti-anxiety medicine pickup. It's such an easy trick, and the pet owners appreciate it, and it makes such a difference when people come in.
And the stress itself can actually make you make a wrong diagnosis, right? They're hypertensive, but they're not really. It's white coat hypertension. Their blood glucose is through the roof because they're so stressed out, and yet that could lead you down the wrong path with a diagnosis.
Yeah. What do you see as the biggest pushbacks that people run into as they start to improve their feline patient monitoring, things like that? Where are the pain points? Say that I wanted to advance this in my own practice as a veterinarian. Where do people run into roadblocks?
I'll be honest. I think a lot of people say, well, we know what a comfortable cat looks like. And I don't actually, I thought I did until years and years ago, started creating the Glasgow acute pain, and validate that scale, which is more than just the face is included, but it's also palpation and so on. And I think what has been overlooked, like if a cat is sitting at the back of the cage, quiet and not moving, people have assumed it's okay. And that's the cat that I would now look at. That would be a red flag, because they often aren't, they're at the back of the cage because they're trying to hide, and they haven't been given a safe place to hide, because that's one of their coping mechanisms, right? They don't have a box to hide in, and they're not moving because they're painful, and they're not doing normal behaviors like getting up and having a nice stretch because their incision on their abdomen really hurts, or they're not grooming themselves because they hurt. And then pain can make them nauseous as well, and then they don't want to eat in your clinic. I mean, a lot of them are just very, like they're suspicious of everything at the clinic. But if we use pheromones in their cage and we do what's called spot cleaning, which I learned from doing shelter work, is that if it's their own cage and they will have taken the time to mark it and put their cheek pheromones on it. All you need to do when you tidy up is just take out anything that's soiled, leave everything else, because they've marked it and they've said this is my safe place. So all I ever do now is like clean up totally soiled articles in a cat cage, and then give them a new towel that has been sprayed and left to air for 15 minutes with Feline to put it in for security. And again, noise, and partially covering the cage, and having the staff all know how to approach a cat, that not every interaction with a cat at a clinic should be for something to be done. I actually advise people, when a cat is staying for several days, that you should prescribe non-medical treatment. So the cat doesn't anticipate that every time someone's at the front of the cage, it's going to be a pill, they're going to do something to you. And we have good data from shelter medicine showing that if you come up to the cage and just stroke the cat, pet the cat, and just have a safe interaction with it that doesn't involve anything, unpleasant, then everything's much, much better. And it would take 5 minutes extra each day or you could have volunteers, obviously, that know that they're going to not get hurt, open up and just speak to the cat and stroke it, or get out a brush and brush it to help it. Because even that in itself releases endorphins, and it is a good thing to do. But every single interaction usually is a medical interaction, and they anticipate it, right?
Yeah.
I would too.
No, that makes.
I would. It's like,
oh yeah, absolutely.
Yeah.
Sure. Every time the door opens, something bad happens, and I get poked with a needle or grabbed by my neck or whatever. Like, yeah, exactly. That doesn't take long to leave a lasting impression about what's going to happen.
So this like positive reinforcement that nothing bad's going to happen. I'm going to groom you, or I'm going to give you just a little bit of really super nutritious food, like a little piece of the tubes of churu, which all the cats love, and they're like, oh, okay, that was okay, and then it was a predictable, positive interaction. And I think they need more of that. And I know everybody is busy. And then to have the time to do that before a treatment and then immediately after a treatment as well, if they're getting an injection or something's being done, would, I think, help a lot.
Yeah, that makes a lot of sense. I mean, everybody's busy. At the same time, I mean, what are the benefits to patient care? What are
Yeah.
the benefits to reducing risk
Yep.
of cat bites and things like
Yeah.
that by creating a
Well,
better
yeah, I mean,
experience?
there
All
is
those things.
good data to show that feline-friendly trained practices have a lower incidence of bite. Well, fewer people in the practice have a cat bite, and that can
Yeah.
take someone out for days, right? If they're a
Oh
surgeon,
yeah.
they're out for days. Very, it's all has to be reported to HR, and it's horrible. So we know that cat bites can be reduced. When people understand cats. And the other thing is a cat that is being totally defensive, you can't nurse it, right? So the actual care of the cat is suboptimal. But if they're, very relaxed and feel secure, you can actually nurse them and take care of them. And things like they will want to eat. They won't have GI stasis because they're so fearful, which then in itself, leads to all sorts of other problems. Hypertension, right? Is it real, or is it that they're terrified of being in their cage? So there's just so much to understanding normal cat behavior and how to make
Yeah.
it a better experience.
No, that's really great. That's actually really useful. I'm gonna sit with that. I like this a lot. The prescription snuggles. I think that's
Yep.
fantastic.
Yeah.
It makes me
Yeah.
happy.
Yep.
What let's jump back for 1 second. So let's say that I have that cat that's just sitting at the back of the cage. So I've got a patient. They had a fairly routine surgical procedure. We're going to say. Now they're just sitting at the back of the cage, and I'm hearing your voice in my mind saying, that cat at the back of the cage, that may be your painful patient. Can you walk me through just step by step? How would you assess pain in this cat? So you talked about palpation, things like that, but just run me through kind of what is your thought process as you're looking through the front of the cage and you see this cat looking back at you
Yep.
from the back.
So when we assess pain, we have two parts. We do we observe them only, and we try and do that without them sort of knowing we're there. So not like right in their face, but just kind of have a look at them in the cage. So that's going to let us see like what their spontaneous pain behaviors are. Now, a spontaneous pain behavior in a cat is sitting still, doing nothing but hunched up. That's a pain behavior. But because it's not like throwing themselves around and wailing like a dog, it's often like ignored as an actual pain behavior. And then we have what we call evoked pain behaviors. That's when we have done the observation and then we actually interact and touch the wound. Sometimes that's possible, sometimes it's not. So for the cat that's sitting at the back of the cage, I would be, if I've downloaded, which probably everyone hopefully will do after this podcast, download the Feline Grimace scale onto my iPhone. I'm going to pull it up and I'm going to look at the cat's face and start scoring it. So we look at their ears, we look at their eye position, we look at their whiskers, we look at their muzzle, because it's called the grimace scale for a reason, right? When you're painful, you kind of go, eh. And when you are a cat, that makes your whiskers move, right? And your whole jaw and muzzle changes. And then the other thing, which isn't actually the face, but it's the position of the head in relation to the cat's shoulders. So cats that are painful will just kind of drop their head down like this, but when they're happy, their head is up above their shoulders. So those are the 5 things that you look at, and each is scored 0, 1, or 2. So you can have 0 for the happiest, I'm doing great cat, and 10, yikes, something's really wrong. And round about 4 or 5, we would say this cat needs rescued or needs to be looked at, like what's wrong. Now, the ear positions for pain and stress and fear are similar. Like, so a cat that's very fearful, their ears go kind of flat, and so does a cat in pain. So we need to kind of figure out, and that's why your nurses and technicians know when they come in for an elective procedure, they're very unlikely to be painful, right? So you do a baseline score. Now, a baseline cat could score 2 for flat ears because it's afraid.
Yeah.
So what we're looking at is differences in that score after the only thing you did before and after is do the surgery, right? So you're looking for the pain scale or their score not to go up. You're looking for it to stay the same. Maybe the flat ears, I'm still a little anxious, but not to go up. And if you take care of anxiety, it'll go down, right? It'll be even better, right?
Yeah.
If you take care of that.
Yeah.
So that would be the first thing, is look at their face, and then we look at posture. And but I think people are finding the feline grimace scale does correlate well with the Glasgow acute scale, which takes a little longer to do, because then you interact with the cat. Like, why, you touch it and stroke it. Does it does it do the usual greet you? Does it not want to let you near it, because that's a bad sign? Do you touch hold their head gently, touch you should be able to touch around and palpate a wound gently if your pain management is adequate or good, without them trying to turn around and nail you. They may, flinch a little bit. And it also helps you look and see if your protocols are working most of the time. And what I can do, even at feral cat clinics, I can go into one of those clinics, do the facial scale, and show that their protocol works for most cats, like 96%, but there'll always be a few that fall between the cracks, even with the same protocol. And that's genetics. Every cat's different. It may have had previous pain. So it may already have come in with chronic pain that we don't know about. And we've added acute pain because we neutered it. There's, and if I went into a clinic and we're rescuing, 50% of the time, your protocol needs reworked, right?
Right. Yeah, no, that totally makes sense. That makes sense. I love the idea of a baseline score, and it's so simple and it makes a ton of sense. And it simply didn't occur to me to do a baseline pain score on a cat. You go, you just came from home. Like, the baseline score is going to be 0. Well, no, we need to start looking at signs of stress.
And the great thing about, if you want to talk about continuity of care, when they go home, before the owner leaves, they can download the Feline Grimace Scale app onto their phone. Right? Or you can give them as part of their, before, they could even do it at the home before they leave, right? To come in, score their cat, and then they can be monitoring the cat at home after a surgical procedure. And, you can say, well, if you score them with this app and their score goes back up to 7, you need to call us. And it could be that the cat is getting more painful. Often it's like, well, you gave me those meds, but I can't get her to take them, right? And that's why she's painful. So it helps with the continuation of care at home.
Yeah, and so the app is approachable for pet owners?
Yeah, it's free. It's one of the number one medical download apps at the moment. And it's for Apple and for the other. It's iOS and
for Android,
Android. Yep. So, and it's free. Yep.
Perfect. Well, that's awesome. I'm going to put a link down in the show notes. I'm going to link to the study so that people can download and have that as well. I'll put a link to the AAFP courses for feline handling. Yep. Are there any other resources that you would recommend for my cat warriors who want to make sure they're doing good pain control and learning what they can to be the best advocates?
So the really good thing about the Feline Grimace Scale or tool is that there is the app, but there's their own website. And if you go to their website, it's like felinegrimacescale.com, you can get it in multiple different languages. The scale is in Spanish, it's in Portuguese, it's in multiple French, and so on. And on that website, they're updating it all the time. What you can do, or your staff can do, is you can go in and score a cat and see how you compare to an expert that has scored that cat. So they're doing it as a training center, right? You can go in, test yourself. Can I actually score a cat? And the answer is, after a few minutes of training, owners can score a cat's facial expression, whether it's painful or not. Yeah,
that's awesome. That sounds like such a fun thing to do with a team. To say we're going to do this together, and everybody gets to do their scores, and then we're going to see what the experts come back at. That's really cool.
Yep. And then what I would remind people is if you have a clipboard or you have an electronic, whatever you do for your post-op monitoring, you put, you're probably going to put like how much fluid they've had or still having, if they ate, what their temperature is, what their pulse respiration is. Just add a line and put feline grimace score. What was it?
Yeah.
Right?
That's awesome. I really appreciate it. This has been wonderful. Thanks so much for all that you do for our patients. Thanks for
Yep.
taking time to be with us. Thanks for all the resources. Like I said, I'll link those down in the show notes. I really appreciate you. Thank you for doing this.
Well, and I'm going to thank you for getting it out to the masses, because that's what we need. It's the getting it out there. I mean, and getting people just to say, yeah, wow, this is kind of cool. And like I always have said, empowering our technicians and nurses that work with us, our support staff, because they're with the patient more than we are usually.
Yeah, I completely agree. Awesome. Well, thank you so much, guys. Take care, everybody. And that is our episode, guys. That's what I got for you. I hope you did enjoy it. I hope you got something out of it. If you did, the kindest thing you can do for me is go and leave an honest review wherever you get your podcasts. If you didn't enjoy it, then the kindest thing you can do is just not leave a review until next week when we have a whole new episode that you might like. And then if you do like it, then you can go leave an honest review. And that would be great as well. So guys, that's all I got. Take care of yourselves. Be well. I'll talk to you soon.